I'm going to talk to you today some of my thoughts about how you rate the size of a population to the type of healthcare that can be provided for that country. Well, it's not as easy as you might think. There's always a lot of criticism of different countries and the type of healthcare that they provide. And why don't they provide a universal healthcare for that country? But there's limits based upon the size of the population. It's just the expenses involved and the pure logistics. So here are my different levels. So you've got level 1, where you've got a population of about 5 billion. You can see it in New Zealand and Northern Europe and countries like Sweden and Finland. It's pretty easy to provide universal health care in terms of costs and the logistics of providing it, numbers of doctors, nurses and other resources, particularly when it's a wealthy country as these countries are. Then you get to level 2. Typical example here is Australia or New Zealand. They're quite a bigger population, 20 to 40 million people. And yes, you can provide healthcare for them. It's quite manageable to lay it out, and that exists. Then we start getting to level 3, where you have 70 million people. Well, the UK has a National Health Service. It's manageable, but it's struggling and it's going broke all the time, and there's just pure logistical problems, too much in terms of admin and management. They lose a lot of their doctors to Canada, US and Australia, so not everybody's happy about it at all. Then we get to level 4, we've got about 350 million. This is the big example here, of course, is the US. A lot of criticism, why don't they have a universal healthcare system? Well, in my opinion, it's almost impossible in terms of the costs, although it's a wealthy country, and the logistics of rolling it out and getting it going. And then we have level 5, 1 billion or more people, China and India. Well, in my opinion, it's just about impossible to have a universal healthcare system for the reasons outlined. So you go from level 1, 5 billion, easily done, to level 5, over 1 billion, pretty much impossible. And then around 20 to 40 million, it's entirely doable. I hope this provides some thoughts for you. Thanks for listening.